even just recognizing the beauty and being connected to like, oh, look at the leaves, they're green. Look at the breeze. Oh my God, the breeze feels so good on my face. You know, like sitting outside on your patio, if you're lucky, looking outside of a window. It really has to do with intention.
For people that are struggling to find optimism in daily life, what would you say are the key habits that can help shift one's mindset from pessimism to optimism?
Yes. So the first thing is just to recognize where you kind of fall along that spectrum, because all of us are going to have a tendency sometimes to be optimistic, depending on the area of life we're talking about, or naturally have a tendency to be pessimistic. And the beauty about practical optimism is that no matter where you fall on this, you can always maximize and enhance your mindset, because that's kind of how practical optimism differs from like toxic positivity, for example, which is like rah, rah, just think on the bright side. But you know what? Not all of us were dealt a good hand in life, right? So that's the beauty, is that even if you are of a pessimistic mindset, the key with pessimism is to recognize when you're being pessimistic, to catch yourself in the act, and to reframe. So pessimism, this is based on the work of Dr. Martin Seligman. He says the 3 Ps, and I've added a 4th one. Pessimistic people, extreme, tend to think when bad things happen, they take it personally. They think that it's pervasive. They think it's happening in all aspects of their life. If I failed a test, it means I'm no good in science, for example, if it's a science test, or I'm a loser. They think it's permanent. So pervasive, permanent, and personal. And then it makes you passive. And so what I've learned as someone who's worked with people recovering from trauma, the big T, the life-threatening stuff, or the little t, grief, disappointment, breakups, job loss, everyday hassles, is that reframing is the key to changing your mindset from pessimism to optimism.
What do you mean by that? What does reframing
the
situation mean?
Yeah, so reframing, like when you're in the midst of grief and loss, telling someone to change the way that they're thinking about something, probably not going to happen. And in fact, I always say to people, you know, if someone came into my office and I told them, just look on the bright side, they'd probably laugh at me, they'd yell at me, curse me, and leave my office. They'd be like, yeah, okay, that's not happening. Like I just lost, this bad thing just happened. So I think of when bad things happen, it's like acute inflammation in the body, right? And you have to decrease that inflammation in any number of ways. That could be in the form of, for example, taking a brisk walk. We know that when you're ruminating, you have a tendency to highlight the default mode network. And that's what happens when you're not actively participating in a task. If you want to get out of that, go take a brisk walk. Optic flow, which causes you to look left and right to make sure you're not getting hit by a car, takes you out of that rumination. And that rumination is what leads to pessimism, is what leads to depression. So that interrupts the cycle, is one thing, is by movement. The second thing can be journaling. And I know a lot of people are like, oh my God, that sounds so woo-woo, or maybe some people are for it. There is so much science, Max, behind the benefits of journaling. Journaling 15 minutes a day, writing about the worst things that can happen. When you do that, that's called a worry diary. And what you do when you write about the worst things over and over and over again, you become desensitized to them, number one. Number two, you start to see themes. Oh my God, I'm someone who tends to be pessimistic about this specific area of my life. Then you notice something that science has found out. 85% of the time that we worry about things, they don't actually happen. And the 15% of the time we do, we're better equipped to handle them than we gave ourselves credit. So worry diarying 10 minutes a day, maybe before bedtime, write down all your worries and think of the worst case scenario. And that might sound so counterintuitive. Somebody would be like, why would I go out of my way to allot time to worry about something? I'm trying to get away from my worries. And the key here is I want you to lean into them, write them, get them out of your mind, get them on paper. And then the best thing you can do, this is where the reframe comes in, is to ask yourself, have I learned something from this situation? Ask yourself, what would I tell a friend? We're often more compassionate and kinder to our friend. What advice would I give somebody else? How am I going to see this 5 years from now? How am I going to see this 10 years from now? Is it even going to matter? Can I tell myself an alternative explanation? So my boss didn't get back to me. Maybe I didn't get offered that promotion. Is there another way to look at it other than they hate me, that I suck? Could it simply be that I need more time, more experience? So then if you can write down the actual outcome, what happens is you were like, oh my God, all the things I worried about never happened. And I got them out of my head and I put them on paper. So these are just some subtle, more tangible habits. I mean, practical optimism really is a practice. It's like a yoga, a fitness, learning a skill, a sport, a language. You have to put effort into it, but it's built on the back of daily, small, concrete habits.
Wow, I love it. So exercise, changing your optic inputs, right? because your inputs, by changing your inputs, in many ways, you can change the content of your thoughts.
Absolutely.
And journaling, which I think is really a powerful means of bringing a sort of meta-awareness to your experience.
Yes, exactly. And like when we have meta-worry, sometimes we're worrying about our worry or metacognition, thoughts about the thoughts. And this just helps you get it out and put it on paper. But journaling, and the way that I'm talking about it based on cognitive behavioral therapy, is so effective because it's not just putting the negative thoughts on paper, which is still very effective. We know that people who journal have less common colds, less infections, less heart disease. I mean, you can prevent, I'm not saying diet, lifestyle, nutrition, sleep, relationships are not, journaling is going to solve all of that. But it holds an important place because what it says is I'm not someone who runs away from emotion. And we know that type D personalities, the type that hold it all in, that try to be so tough and stoic, you actually expend more physical and emotional energy by stifling and suppressing your emotions than you do by expressing them. And where is that going to come? It's going to manifest in the form of headaches, panic anxiety disorder, chest aches, heart attacks, you name it, from head to toe, bowel symptoms, insomnia, the list goes on.
Wow. And some degree of pessimism is fairly innate to the human condition, is it not? Don't we all have some sort of hardwired negativity bias?
Yes, totally. And it's meant to protect us from an evolutionary point of view, and it has real value. And in fact, we know that pessimists are actually more thorough and more analytical and more accurate in their assessment of people and of situations. The difference is that optimists may have a tendency to see things naturally on the positive spectrum, but practical optimisms are sort of your realists, but enhanced. They're sort of the realist 2.0 because they have a tendency to have aspects of pessimism. They're like, okay, I can read a situation and I know someone's BSing me here, right? But they're not going to let it get in their way. So they're like, practical optimists can see through things and they can see through people sometimes and they can work with them. They're like, okay, so this person isn't going to help me. So path A isn't going to work. So what about path B and C and option D and E? And they'll go all the way to Z. So they're not mired in negativity.
Very interesting. How has your work surrounding 9/11? I know you did a lot of work, in the World Trade Center and in the aftermath of 9/11. How has that informed your clinical practice?
So much, Max. When I took on that role, I was right out of residency training, and I was recruited for this job, if you will. And there's always imposter syndrome where like, okay, I'm not even 30. Like, how did I get this job, and what am I doing here, and why are they giving it to me? But then, I spoke to mentors. I got training in trauma. We had peer groups. Like we were kind of all learning all at the time because nobody had ever seen this kind of like level of mass disaster and devastation before on U.S. soil at least. And so we learned a lot from people who had worked, at the VA, and like that was working at the VA was a big part of my training, and I ended up teaching there. So I spent probably 15, 20 years working with veterans, and I learned so much from them. And that really inspired my work in Practical Optimism because I wanted to learn about resilience. And resilience is about bouncing back from adversity, but flourishing is about thriving in the face of it. And so I spent the first half of my career helping folks manage disease and manage illness. But now I want to help them really go from not only dysfunctional to functional, but from functional to optimal. And the beauty of Practical Optimism is that even if you're living in chronic pain, even if you're living with sadness and grief, you can find glimmers of hope. You can find aisles of positivity. You can find and create oasis moments. And what I learned is that when I looked at the literature of resilience, there were certain key features. Resilient people have a tendency to have cognitive flexibility. They're very adaptable. They're able to do the reframing. And even if you're not able, you can learn. And that's something I learned from my own cognitive behavioral therapy. Being on both sides of the couch was so super informative. And that was another key instrumental, force in all of this. So going back to resilience, having a moral compass, having an altruistic bend. I remember that as part of our program, people would all get screened for medical and mental health problems. So somebody could potentially have gastric problems, maybe even early signs of cancer because of the smoke and the toxins that the dust and debris that they were exposed to. They might have allergies, sinusitis. So we saw a lot of physical problems. We also saw a lot of anxiety, post-traumatic stress disorder, depression, substance abuse, domestic violence. A lot of folks had prior existing history of trauma, and they were involved in cleanup, rescue, recovery. These were some of the Wall Street types living down there. Residents, like really all intersections of life and demographics. And so you'll never see anything like this again, and I hope not. But what I found was a lot of people may have come in for the medical screening. They also got our mental health screening, and yet they never qualified for mental health treatment simply because they never got diagnosed. And so these folks, we thought of them as sort of being healthier, more resilient mentally, and we're like, okay, we did checkups on you, and we've been following you, several times a year over the course of X amount of years. Why haven't you, quote, broken down? What is going on with these folks? And I got really interested. And what I found is a lot of these folks would come to the clinic to support other patients. They would travel with them 2 hours, 3 hours to make an appointment, because in trauma, panic disorder, you don't want to take public transportation. You avoid reminders of being in the city, of the flashbacks and nightmares, so all the things that can interfere with your treatment. And I remember there was a woman, and her name was Teresa, and we got to speak in Spanish, and my Spanish isn't great, but I always try. And I asked her, I said, Teresa, ¿cuál es su secreto? And,
that was pretty good.
Yeah, thank you. And Teresa said, mi propósito, my purpose. And I was just like so touched by that, because I was like, I see you living your purpose. Your purpose, altruism, is what is protecting you, amongst other things. But we know that people who volunteer 2 hours a week on average, live longer. We know that children, adolescents that volunteer, even if it's just helping younger kids doing their homework, have less inflammation, less heart disease later in life. So I can go on and on about the beauty of resilience, but what I learned and what was most important to me was that optimism was a key component of it. So I can go on about what I learned about it, because I learned so much. This was like eye-opening for me, Max.
Wow, it's fascinating. So feeling connected to something larger and more important than yourself.
Yes.
Really.
Yes. And, there's so many easy ways to do that. And I think what I'm worried about now is that so many people's mental health is going down the drain because we've become so self-absorbed, right? And there's nothing wrong in self-preservation, self-care, but when you make your problems the center focus of the universe, and I'm not saying you shouldn't, in order to solve them, but there is a point when the cost-benefit ratio starts to wear. And what I would say is feeling part of something bigger than yourself is an important part of mental health. And it can be as simple as being in nature. And we know so much research in nature 2 hours a week, 15-minute increments, sitting on a park bench counts. But that sense of awe that you are a speck in time and that's all you really are, it is not meant to minimize you as a person. It's to remind you of how lucky we are to be here and how we have to take care of the earth. And that's a whole other thing, nature relatedness, taking care of the earth, feeling connected to it, and recognizing that you're part of something big is such a big part of purpose.
You live in New York City, right?
Yeah.
Living in New York City, how do you find, how are you able to connect with nature, right? Like it's such an urban sprawl, right?
Yes.
It can be difficult to say the least.
Yes. So I lived in New York City for 20 years. I just moved out like a mile away, and I am I'm in an urban environment near rivers and city parks, and it is hard. It really takes, and we went out of our way, and got a second home simply so we can be, yes, privileged, but hard work, and so that we can be by nature. And hiking was really important, especially during the pandemic. But people don't realize that even 15 minutes a day of, like I said, city park bench for so many years when I'm now I have the benefit of doing remote sessions with patients and also in person. But I made a point to get an office near Madison Square Park, like Gramercy, so that I could sit for 15 minutes and get some sunlight. And that's like the highlight of my day. And little increments, you talk about the benefits of sunlight and shutting melatonin down and connection, but you have to fit it in. And what you don't realize, you have a plant behind you, right? Even just recognizing the beauty and being connected to oh, look at the leaves, they're green. Look at the breeze. Oh my God, the breeze feels so good on my face. Sitting outside on your patio, if you're lucky, looking outside of a window. It really has to do with intention and where you want to put your focus. And if you can't break the cycle of rumination, ask somebody else how they're doing and just listen to them. It sounds so simple, but it takes the focus off of you, and distraction, believe it or not, healthy distraction in small increments can also be a powerful tool to break that cycle of rumination.
Wow. These are fake plants, but they're probably still doing something for me.
100%.
Right?
The green. I'm admiring it still.
I love that. A lot of mental health experts will say that we are living in the midst of a mental health epidemic, an epidemic of mental health, of issues related to mental health, whether it's, abject mental illness, right? Or just, widespread despair, anxiety, comparison, and other things that instigate undue mood, problems related to mood. Would you say that that's true?
Yes, yes. And it makes me sad because I've never met a person who I wasn't able to find something beautiful about them, whether it's their smile, their sense of humor, their analytical nature, their thoughtfulness, their kindness, their brilliance, their creativity, right? So the fact that we are spending so much of our time, A, online, and B, that time spent on comparison, whether you recognize it or not, you're human, and the more time you're going to look at other people and their fabulous lifestyles, even if it's just to keep up, just to know what's going on. I mean, there's a healthy protective element of knowing what's going on in the world, right? And it also can be used as a motivational tool to enhance and to connect, right? Like that's what I love so much about social media is that I've been able to connect with people or stay connected to people I met, including you. So it is very, very helpful. But the other side of it is very quickly you're going to be seeing images and the subconscious mind is going to tell you you're not enough. And to be honest, Max, that's why I avoided coming onto social media as long as I possibly could until it became a necessity as part of my work, where I was like, I don't need to feel less than. I'm comfortable in my body, I'm comfortable in my skin, and I want to own it and I want to be happy. And even the people who know the science and who know the literature can be affected by it. So definitely, and that's why I'm worried because at least I had a life and knew a life in a time before social media was so pervasive. And yet I know that people who are growing up now won't. And when what the studies show about the social media mental health connection is, number one, it's not, is social media good or bad, right? It's more about what is it taking away and what is it compromising as a result, right? The sleep, the exercise, and the in-person connection. And that there's this number, I mean, people have said maybe 3.5 hours as being excessive social media use per day. And it's a number, and you could really say, really anything more than 30 minutes, we know studies show that people's mood dips and then they become at higher likelihood of depression. And it's hard to know which came first, chicken or the egg. Is it that you're already depressed and so you're alone at home and you're inactive and you're scrolling and you're drawn to these images? Or was it as a result of it? And that's hard to know, but I would say that having awareness in all of this, sort of like if you're on your journey to practical optimism, and I hope everyone is, because it's meant for all of us to be kinder, happier, and healthier, wealthier, more productive people, you have to have awareness so that you can short circuit and be like, you know what, I'm starting today. And if you fall off the wagon, come back again. But that awareness of, oh my God, my attention is not my own. I am at the mercy of fill in the blank. Companies, pharma, whatever it might be.
Yeah. I wonder if the consequences of social media are a direct result of what social media is exposing us to, or the fact that it's effectively preempting like mind wandering and just the blank space that like we all, our ancestors, our, prior generations all would have experienced in those moments of boredom, which we now feel, it's like a trigger moment for us, you know, like we just can't, we're so used to just reaching for our phones at the, at the earliest onset of lack of stimulation, right? Because we're like addicted to our devices at this point. And it's like, it's basically handicapping our abilities to go inward, maybe even ruminate and meditate and think about the things in a more productive way. We're supplanting that innate tendency with just noise.
Yes, 100%. And we know this for a fact in kids and for adults, is that boredom leads to creativity. And if you don't allow yourself to be bored, you are handicapping yourself. Like you really are limiting your exposure to all sorts of things that come from stillness. And I know that, like say if I'm going for an ocean swim, and that's really where I feel most enlivened and invigorated and get a lot of my dopamine, a lot of my creativity and productivity. So I'll leave my phone, hopefully in a trusted place and no one runs away with it, but like on shore. And, in the summer, I'll be, let's say, swimming in Montauk in the Atlantic and it is freezing. So I'll stay in the water as long as I can. And all sorts of thoughts will come to me. And so much of this book was written in the most unusual of places. And part of it was in the ocean, swimming, and not looking on my device. I will look at my device to take the notes when I come back to shore, and I'll be like, oh my God, I got this great idea and this is how I want to phrase it. And I'll put it in my note section. And then it's great. Use the social media for what it's intended to do, is to be social, right? And to say to yourself and be intentional and be like, I've put a 1 hour alarm, on Instagram for it to kick me off. And I don't always choose, gives you a choice, right? And so I can choose to stay on longer, but at least I will have reminded myself, like, Sue, do you want to be intentional about this? So it's a reminder, doesn't always work, but at least it's existing. But the creativity and the boredom connection is huge. Allow yourself to be bored and populate your calendar with activities that will force you to not be able to be on your phone, right? So if that means you're going on a hike with a friend or spending time with people, really that's going to be the key. And doing things that you love, that give you so much joy and pleasure. And I would say to you, if a person is feeling down, ask yourself, when is the last time I did something that made me really, really, really happy, right? Because like, what do I love? And when is the last time I did it?
Is there a way in which being lazy can actually be good for you?
Yes. And it's so funny because in our society, laziness has such a negative connotation because we're such like, there's like that hustle culture and work warrior and productivity. But there's a part of laziness which I think it can be productive as long as it's intentional and deliberate. So, you know what happens is a lot of people may fantasize, oh my God, I wish I could have a year off. I wish I could have a sabbatical. And what we find often is that long periods of time when they're not at your choice, let's say a job loss. Let's say somebody was hoping, wishing, wanting for time off, right? But the next thing you know, they lost their job. They didn't have agency around it. They didn't choose the time off. So when time off comes, when it's not of your choosing, it does not feel good. However, when you structure a vacation or a weekend to do nothing and you schedule it that way, it feels very different. And you know what's interesting is that there's a lot of studies around the benefits of leisure time for mental health, and they find that like it lowers your blood pressure, decreases anxiety and depression. But it was a very interesting caveat. Leisure time is only beneficial on a mental health point of view for people who value it. If you are someone who feels like you have to be productive and that you're going to berate and beat yourself up for the time off, it doesn't have the same benefits.
Wow. So interesting. So it has to be intentional. And I would assume that that doesn't mean spending that time scrolling Instagram or Twitter or X or whatever they're calling it these days.
Yeah. And it might be, look, for a lot of people, they find joy, but again, it depends on what you're looking at, right? If it's like cute, funny cat and dog videos and like little kids and like things that are sweet and innocent and like, this sounds kind of cheesy, but things that are wholesome, right? Like things that are going to make you laugh and feel silly and feel like a child. Like I really love humor memes. I will send them to my friends and we'll laugh. And
obsessed. I love meme culture.
I do.
Yeah.
It makes me happy and it makes me feel connected, right? I'm like, oh, I feel so seen right now, right? Like, so that's awesome. That's great. But if you are spending time being reminded of how you're not enough, because that's really like I might look at like some, great beach bodies, right? And I'm like, okay, great. This is at one point it's inspirational and aspirational. And then pretty soon it goes down because you're like, I don't know. I don't have the time for that. Like, I want to be healthy and fit, but like that's whole next level. And then there's this cognitive dissonance and like a small amount of dissonance that spurs motivation, action. Because this is what I think about. I say, if you're feeling FOMO, small amounts, it maybe means that it's time to pay attention in certain areas of your life, right? So if you feel like I'm happy for my friend who's achieving XYZ, but now I'm feeling bad about myself. Okay, maybe this is your time to take that course, listen to your podcast, get motivation, get education, get information, educate yourself. But then it has a sort of like an inverted U-shaped curve. A certain amount of it will increase your productivity, maybe your curiosity, your motivation. But then when it supersedes, it's sort of like we feel good when either we're looking at, let's say, a celebrity that's like way above our league because we're like, there's no comparison here. I just love you. You're just amazing, right? Like the Venus and Serena Williams, of the world, right? But when you're comparing yourself to someone who might be close to you, then you're like, okay, I can do it. I can achieve it. But then when it's like this gap that feels unattainable or unachievable, but you want it so badly, that's when it starts to decrease motivation, decrease productivity, and cause more anxiety and depression.
How does this apply to like body image issues? Because I think we're seeing a rise in incidents of like orthorexic behaviors. Obviously there are fantastic Fitspo accounts, and I definitely follow some of them. I like actually going over to my Explore page and seeing what, somebody who's like way more jacked than I am is doing for their workouts. But I think for the vulnerable,
yes,
it can create feelings of, what I'm currently doing is not enough.
Yes.
And lead to all kinds of anxiety around healthful habits.
Yes, it's so tricky, Max. It's like because the same accounts and the same people that make you feel so good, right, and feel so inspired, can also be the ones depending on the day, and like, so I think it's really important to know, maybe to kind of, whenever I talk to patients, I always ask them to give me like a mood rating. So on a scale of 1 to 10, 10 is your best mood, like you just, I don't know, won the lottery or, won an award, and then 0 to 1 is like, I don't want to get out of bed and I'm feeling like life has no meaning. And by the way, if you're ever 0 to 1, please get help, like 988 helpline or seek therapy, right? So that's not normal. And most people, depending if you're not, feeling depressed, you might be around a 6 or a 7, right? But if I'm particularly vulnerable today for any number of reasons, and your mood is like a 3 or a 4, right? And it doesn't live there, because even if you're living at a 3 or 4, I would say to get help, psychotherapy and or medication if needed, right? Because that's a very individual choice, and in the right context with the right person, risk benefit, discussing risk, alternatives, side effects, all of that. So that's a very individual choice. And for some people, if you can't get out of bed and you're thinking of, not living, they're needed. But for the average person whose mood is like a 6 or 7 and you're feeling vulnerable, then I would say be careful what you're going to be consuming that day, right? Because it's just like, I know people who are so in tune with their bodies when it comes to food, right? And alcohol, like they'll be like, no, I'm driving, I'm not going to be taking that. Or I don't want to drink right now, or I'm doing dry January. I feel like people are very, very thoughtful and intentional about things that they can touch and that they can feel. But they maybe aren't always so in tune with their emotions and their emotional susceptibilities. And even when I talk to people about it, the word vulnerability has such a negative meaning. And I'm like, no, don't look at it in a bad way. Just know, maybe we can call it susceptibility. Today, you might be more susceptible to consuming information that makes you feel inadequate. And that's what FOMO, fear of missing out, is about. Inadequacy, anger, fear, irritability, comparisons. And, it is true. Comparison is the
thief of joy.
Yes.
Yeah. Where does medication place within your philosophy on clinical care? We don't like to place a stigma on drugs, but I don't think there's any. I think it's fairly irrefutable that drugs tend to be overprescribed.
Yes.
Especially in the era where your average patient gets like 15 minutes with their physician.
Yes.
I don't know what the specifics for the field of psychiatry, but when is medication the right choice for a given patient?
Yes. So I look at medication as just one component, but it can be an important one, as part of a comprehensive treatment plan. And that's why I wrote this book, because I wanted to arm people with hundreds of tools at their fingertips and with a feeling of hope and positivity and pragmatism, so that they didn't feel like they didn't have any choice and that medication was the only option, because it never is the only option. And even if you are on medication, you must do everything in your power to really take care of yourself head to toe. And in my chapter with the 8 pillars of practical optimism, the 8th pillar, and they're no particular order, but it's called practicing healthy habits. And in it, I talk about the 4 M's of mental health. And these are things that even if a patient is on medication, I say that you must do this for yourself. This is medication. I will write it back in the day when we had prescription pads. I didn't call it the 4 M's of mental health at the time, but I would write on them. And I only did this for like effect and for them to take it super seriously. I still have a prescription pad, but nobody uses it the same. Like I wrote, whatever it was. But now the 4 M's are mindfulness, movement, meaningful engagement, and mastery. So even if you are on medication, you must do this. And the importance of medication is, look, there's some people who will say, I can't even get out of bed, right? Like I can't even make it to my appointment. Like all of the philosophy that you're sharing and your positivity and pragmatism and your scientific pearls, because every single thing and I wrote in this book was based on evidence-based, peer-reviewed journals as much as possible. And I didn't want, even though I have 20 years of clinical experience, I never wanted anything that I'm saying to be enough. I want to be like, there is science behind this. So don't just take my word for it, even though my word is based on science, but fine, take the scientist's word. And I think of myself as that, right? So when somebody comes to me and they say, I don't feel like life has meaning anymore. I really want to explore that. I don't feel like I have a purpose.
There's no medication that's going to give your life meaning.
Yes. You have to infuse meaning into your life. But sometimes in the midst of depression, and you are like well aware, you talk about gut microbiome, like we know inflammation can cause depression. We know that there's so many things in our diet, our food, our environment, our connection. There's a million reasons that got a person feeling as low and as down as they are. Sometimes in the midst of crisis, you cannot conjure up hope, no matter how hard you try. And in these moments of darkness, of bleakness, of despair, you just have to believe that things can get better. But it is very, very hard. And I've seen this because I've been called to the bedside of a patient who might have overdosed and tried or attempted to end their life. And I've sat by them, and I will tell you, Max, that the vast majority of them have said, I didn't want to stop living. I just wanted to stop living with pain. And that's an important distinction, because most people want to feel something positive again. And anhedonia, lack of pleasure, lack of meaning, lack of purpose, all of this coincides with depression. And so we really need to equip ourselves and put a lot more resources and tools in preventing mental illness, because 1 out of 4, 1 out of 5 of us will have it. And, it's easy for me to say, but it has to be a movement, and it has to come from every direction, from, down, bottom, up, from up, top, down. And it has to really spread to the masses. We need mental health, more mental health access to facilities and care in schools. It has to be part of our language. Like, we need financial. I feel like there are few things that are missing: emotional literacy, financial literacy, right? Like, it's great to have a degree in fill in the blank, like art history. I'm all about the humanities. I studied psychology and pre-med. Like, I love language, I love literature, but I want people to have equipped basic tools, and coping mechanisms are one of them. So if a person is drowning and you're like, just run a triathlon, they can't even lift their head above water to hear your advice and instruction. So that's when I say medication can be very helpful to get the person out of drowning. Their head is bobbing up and down. Their head can't even get above water to be like, Doc, what did you say? I'm listening, right? So that is where medication can be helpful. But the problem is, it takes 6 to 8 weeks to work a lot of the antidepressants. Then I don't love the weight gain. I don't love a lot of the side effects, sexual dysfunction. In adolescence, small, risk of increased suicidality even, right? Small, but it's present. So we have to be very carefully monitoring. Here's the thing. A lot of the primary care docs, some of these folks are my best friends. The problem is psychiatrists are only prescribing a fraction of the antidepressant medication or the psychotropics. It's a variety of other specialists and subspecialists. So the cardiologist, the GYN, the primary care doctor, they're the ones, the cancer docs, like they're the ones prescribing. And the problem is they've got, like you said, 15 minutes. They're taking care of your blood pressure, your heart disease, your cholesterol. Do you think they even have time to talk about mental health? And what's happening is these doorknob comments is what they're called, what we learned in medical school, where the doctor's like, okay, we've done your annual physical, and they're about to leave, and they have their hand on the doorknob, turning it, leaving. And then as the patient, you say, oh, doc, but like, I think I'm depressed. And they're not creating time at the beginning of the session, because there's so much shame and stigma. A lot of times people will say, my primary care doc knows me for so many years. I don't want them to think badly of me. They know everyone in my family, or they don't know me and this is a new person, or I'm at the urgent care and I don't want to like go into my whole life story, nor do they have the time or interest in listening to it. And what happens, and Max, I've been teaching a psychopharm course for years to therapists, like non-MDs, and I will often talk about this. What happens, what I see is a patient will go in, they'll mention, I'm feeling sad, bad, blue, but the doctor may not have the time or the training or the expertise to be like, all right, let's do a thorough assessment. And a thorough assessment for your mental health cannot happen in 3 minutes, because that's probably the amount of time. If you only have 15, they're talking about your other medical history to go into mental health. You need time, whatever that time is. A very skilled, trained professional can do it in 30 minutes. Some people need 45, some people need 90. Some people will say, I need an extended evaluation, come back a few weeks. So you've now just given a patient a prescription based on a symptom. You have not done a proper workup. We know that thyroid problems, diabetes, cholesterol, stroke, any number of medical problems, the way you're eating, your diet, lack of exercise, lack of community engagement, there's so many things that could be contributing to your depression, and you've just gotten a prescription without knowing the whole story. Is your anxiety part of ADHD? Like, we don't know. Is it part of any number of things? So, or is there something else going on medically? Is it your thyroid, vitamin B12, vitamin D? So you leave with a prescription with sometimes unclear parameters around what to do with it. So, I always say start low and go slow. But they might leave with a prescription for the lowest dose, but no one's told them in 1 week time or 2 weeks time or whatever, you need to increase it. You need to titrate slowly. No one's going to tell you that. And so let's say 2, 3, 6 months later, you're on the starting dose and you're wondering why you never got better. So the dose never went up. Or you had side effects. Nobody went into the side effects that you're going to have sexual dysfunction, headaches, whatever. So no one told you any of this. So then you just stop taking it. So for any number of reasons, you stopped taking it because you didn't know what to expect, nor did you ever get a clear endpoint. And for me, whenever I start medication with someone, it's done very carefully. It's done done very deliberately. It's done very thoughtfully. I have a lot of patients I do talk therapy with. I never prescribe them medication. Or I might say, I'm going to closely follow you. And I get it. It's a privilege to have mental health treatment in this country, to have any kind of medical treatment. I may say, come back in a week. Let's follow up. Call me in between sessions if you're not doing well. So I'm ready at a moment's notice to hear when their sort of risk level. And I'll also do a very thorough risk assessment to understand like the risk of self-harm, right? Like prior history of suicide, trauma, all of these things, access to means, getting collateral. So getting like with their permission, history and input from other providers or from people in their life, whether past medications have been helpful, what they've tried, what the side effects are. So really you make a decision with having all of this knowledge, which is not happening in your very brief visit with a medical provider often. And only then should you very carefully, thoughtfully, not only discuss risks, benefit, alternatives, but also the endpoint. You know, when are you going to get off and what is that going to look like and how, and maybe you don't have to have the endpoint because they're like, doc, I can't even get my head above water. But I think it's important to have an endpoint. And to your question about when is it like reasonable to start a medication, let's say you have someone who's like, I'm managing a team, right? That might be the head of a household. It might be a mom. It might be a dad. It might be a CEO of a company. So what's at stake? Is it their life, their productivity, their livelihood? Are they like having, you know, sort of functional impairment in their life? How quickly do they need to get better? What's their support system? So it's like, it's such a very complex and nuanced conversation.
Is it typical for primary healthcare physicians, cardiologists to prescribe antidepressant drugs?
Oh, yeah. The vast majority of antidepressant medications are written by non-psychiatrists.
That sounds so odd to me. Like, are you regularly writing prescriptions for statin drugs?
No, definitely not. And I'm so glad you asked that because, you know, here's the thing. A lot of primary care doctors, a lot of specialists, they will say, I am trained in this. And yes, we were all trained in medical school, but I can tell you that the average physician is probably training, like doing a psychiatry rotation for 6 weeks and in medical school in their third year. And now they're 20, 25 years out. Yes, they are knowledgeable. But I will say what I'm often seeing is when somebody will come to me and they'll be like, oh, this medication didn't work for me. And I'll be like, okay, tell me about it. And they'll be like, oh, I was started on this dose of this medication. And I'll be like, well, that was the starting dose. Oh, well, I didn't know and it didn't work, so I stopped it. Or I gained weight and I stopped it. Or any number of things. And if it's going to, my sort of very respectful and humble advice to, you know, doctors who are non-psychiatrists prescribing this is, you know, ask the patient, you know, could we book a time to talk? Of course, it's not always going to happen. Sometimes someone is in the midst of crisis. It's an emergency. Have a list of referrals to therapists, to talk therapists in the office, if at all possible. Have either contracts, you know, or just say, listen, these are the people within your health insurance that are willing to accept it. So if any kind of like a funnel or channel that you can do with a talk therapist, even 8 to 10 sessions of talk therapy can be super beneficial. And then discuss with them risk, benefits, and alternatives. Tell them to come back and say, listen, I want to see you in 2 weeks. I want to see you in 4 weeks. I want to see you in 6 weeks. Or have a handout prepared to say, these are the common antidepressants. These are the common side effects. This is the dose. This is the titration plan. This is when you need to call me in. And have an NP or any number of physician's assistant, have anybody online, the helpline to answer. And now the health insurance companies, you know, if you're lucky to have it, have people that you can call, behavioral health providers, and at least kind of walk you through what you can expect. Because one thing I realized, Max, this was a very interesting, eye-opening experience. When I was in medical school, we would go through all the rotations and we would be on the internal medicine floors, and some patients would get admitted and they would be on, you know, let's say 15 different medications for cholesterol, statins, all of that stuff. What I noticed is when the list was given to either the residents in training, you know, the doctors in training, me, or to the nurses, and let's say they were on a variety of medications for their body, all of those medications got entered into the computer. Guess which ones were often left off?
Which ones?
The antidepressants.
Psychiatric drugs?
Yeah.
Wow.
Because they were just seen as like placebo. And what we would see is people would all of a sudden, some of the medications can have discontinuation symptoms, and you can feel like you're having, like, not all of them, some of them, but to abruptly stop a medication. I'm like, no wonder this person is having headaches on the floor after they've been hospitalized, or brain zaps, or suddenly feeling really low or nauseous or flu-like symptoms. because some of the medications are shorter acting, and if you were to stop them abruptly, they can cause a lot of physiological symptoms.
Oh yeah, my mom was on sertraline for years, and we tried to titrate her off, and it was just very difficult. I mean, the withdrawal symptoms or whatever they call them, like, yeah, really significant.
Totally. And it was just never not valued or seen or appreciated in the same way. It was always seen as like, oh, this is like an add-on, it's a luxury. Like it just didn't have the same appreciation. I think things have changed now, like in the last 10, 15 years, there's definitely more appreciation. And I'll hear my like doctor colleagues in other medical specialties say like, oh my God, you have no idea. Like 2/3 of my practice, they'll say, folks, it's somehow tied to their mental health status. Like they all have a nuanced appreciation. They're like, I wish my patients had someone to talk to. I wish I had more time to talk to them, and I want to help them. I just don't have the time.
Per capita, people in the US we have the highest proportion of antidepressant users in the world. There was a startling graph that I shared on social media, and the data came directly from the CDC, if I recall correctly. And it was like a hierarchy of like all of the major countries of the world, and the United States was at the very top. Per capita, something like 1 in 10 people are on some kind of psychiatric drug.
Yes, and like anywhere from totally like 1 in 8, like above the age of 12, has like been on it, like has tried it within an X amount of months, and especially women in midlife, Max, because this
1 in 4, right?
Yes, and
shocking.
It's so shocking, and like I mean, we're learning more now about obviously like hormones and perimenopause and menopause, and like that's, SSRIs are no longer like the go-to. Like there is more appreciation, I think, definitely on social media, but it's also just sad and scary to me, and I'm also not surprised by those numbers. Like as a psychiatrist, yes, I can prescribe medications, but that is not my first choice. It's not my second. It's not my third. Like I don't want to say it's the last thing, because if somebody needs it in the depth of crisis and loss and tragedy, and then they don't feel like living, like 100%, I want to do what I can to support them, to get them better as soon as possible. But if I at all have the luxury of time and space to work with a person, I'm going to just carefully monitor them and say, I have it in the back of my mind. Because, they say that expression, like, if all you have is a hammer, everything is a nail. And I feel blessed that I can do talk therapy in a way that gets results. And because I can't see everyone in the world, and I wish I could help everyone in the world, that's why I wrote this book. Because I was like, I want to give you the tools that I learned, some of it the hard way for myself, some of it through evidence-based research, some of it through patients, the best things that you can do. So if you need medication, fine, no shame, no stigma. But you know what? There's so many other things that you can do. Medication should not be the be all end all.
When it comes to, we've already talked about movement. When it comes to food and the like, are there any foods, dietary patterns that you find to be most supportive of good mental health?
Least processed possible. I mean, you're the expert, Max, of this, right? Like I see things with omega-3, like the nuts, the seeds, the ultra processed foods. I mean, we're seeing like younger people go through puberty, right?
Yeah, precocious puberty. It's on the rise. Yeah.
Yes. And so I'm just worried about that. That's the number one thing. And like obviously the Mediterranean diet, like as much as possible. And then, just the whole thing about gut biome, microbiome, and anything that you can do to maximize. Prebiotic. I know you're huge on all of that.
Yeah. I mean, I've definitely evolved in my views on this, but I think the more closely you can adhere to a whole foods predominant diet, I think that's definitely the way to go. A diet that includes both animal source products and whole food plants. I think it's win-win. I mean, diet isn't... diet may be the cause of depression for a subset of patients, but I don't think there's any harm, particularly if your diet does represent the norm in this country, which is, at this point upwards of 60% or just around 60% ultra processed foods as a proportion of calories. I think, it literally is only win-win, right?
Yes. And it should be like, it very much should be like, and I say to somebody, like, just like you had asked me the question about the statins, like, do you routinely do that? I don't. And I know my place. And I know that, if I'm more than happy to hook patients up with, okay, how do we get you nutrition consult, right? Like, so like, if I'm not the expert in X, Y, and Z, how can you, but so much of it also comes back to habits, Max, like, right? Like, I understand. And I love how you all will talk about the cost of foods, and like, sometimes you have to be a little creative of like how you're going to get things. But there's always this fear of like, healthy food is so expensive. And yes, and we do have like these great areas in the world in terms of like, or at least the United States, of like food, like, what is it called? Like
food deserts?
Yes, yeah. Yes. But I think you have to be intentional and like thoughtful about it and understand the connection to food and mood.
Yeah, I mean, eating healthier can be more expensive, but I don't think it has to be. Like, and it's also eating healthy is a continuum, right? It's like it's always a question of like, when assessing how quote unquote healthy a food is, the question that you should always ask is it like compared to what?
Yes.
Are we talking about, if we're talking about conventionally grown produce, like, yeah, there are some people on social media who will say that that's, we should only be eating organic. And I don't believe that, because for your average person who's eating boxed mac and cheese for dinner and doesn't know any better, a conventionally grown bowl of dark leafy greens, I think, is going to be the way better option,
Yes.
And we're both so lucky in that we live on the, we spend most of our time on the coast where we have access to really healthful food, but you have to meet people where they're at. Something that I've become increasingly convinced of.
Yes. And I love that, the meeting people where they're at, because anything else feels dismissive.
Yeah.
And you're going to lose someone. You're going to lose an audience by being sort of very extreme. And I think that's something that I've learned over time is there's an idealistic way of doing things, and then there's a realistic, and giving people options. And that's why I love like so much of like what you share on social media. And I've told this to you before. I'm like, I'm always learning from you. And I love how you're like, you can eat this. Like if this is what you're going for, look at how many calories. So like sort of just being, I think, critically examining things, whether it's food, whatever you're consuming, because I think it's so easy to jump on trends, and like people will send me like, this is the newest thing. And like, I've never been into trends. I'm like, I think of myself as sort of like classic, and also just a little bit skeptical. Like I want to do my own research. And part of research is exposing yourself to things you don't believe in. And people who have contrary points of views. I mean, like then, they say like that's the marker of intelligence, right? To be able to hold opposing ideas and then eventually to be able to make your own decision, which isn't happening so much these days.
Yeah. And people love to hate on mainstream media, but I feel like, and you're probably one of the few people who can understand this sentiment. I feel like it's an amazing privilege to get to speak on the platforms that you and I get to speak on regularly, whether it's the Today Show, the Dr. Oz Show, because you get honed by that experience of getting to speak to broad swaths of the American public, right? Because social media these days, social media is not real life. Like even my own Instagram it's an echo chamber, right? At this point, and it's not because I've created an echo chamber. It's just that those are the people that are on social media looking for health related content.
Yes.
People that know what a ketogenic diet is, or know which isn't necessarily a diet that I promote, but when you are on a platform like the Today Show or the Dr. Oz Show, you're reaching the food deserts. You're reaching all of these other myriad parts of the country where they don't have access to pristine grass-fed, grass-finished beef. And I'm hyper aware of that. So as much as, for example, like with red meat, which I've become, a big advocate, not at the expense of other food, but I'm a big advocate of the inclusion of foods like red meat, in one's diet. I think that if your message is only that it's the grass-fed, grass-finished red meat that somebody ought to consider including in their diets, well, you're missing a huge proportion of the country that doesn't have access to that kind of food, right? And even conventionally produced red meat, in my view, is a healthier option. Like, again, going back to compared to what? A healthier option than what most people are eating, 3 meals a day.
Yes. And I think that for me, the take home point is having options, having flexibility, and developing awareness, like constantly be willing to challenge yourself, whatever it is that you're doing.
Yeah, always. So when you wrote this book, Practical Optimism, I mean, there's a ton of research that went into it. Anything over the course of writing the book, I mean, you brought to it, obviously, all of these years of really powerful clinical experience, but anything surprise you over the course of writing the book?
Yes. I think the whole premise of optimism and its benefits, like, I feel like this is such an untapped resource, Max. Like, people have no idea how powerful it is. So optimism is genetic. That's something I learned, that researchers had found an association between optimism and the oxytocin receptor gene.
Wow.
And this gene, oxytocin, known for cuddle bonding hormone, social emotional learning, relatedness. But what the fascinating part was, if you are not born with this glass half full mentality, don't worry, you're not going to get left out. So they did think that people who are born with a certain variant are more likely to be optimistic, and those who aren't might be pessimistic or more likely prone to depression. But what they found is really what the gene codes for is a set of skills. And these skills are having good coping mechanisms, psychological resources, being able to ask for social support. And I was like, wow, this is what I'm already doing in my practice. And this is related to optimism. Well, you know what? All of us can learn it. So even if you are born glass half full, half empty type, even the pessimist can still learn. So optimism isn't just having a positive outcome. Optimism isn't just having a positive outlook. It's also about creating positive outcomes. And that's where practical optimism comes in. Practical optimism takes sunny skies positivity and it puts it into action through developing sort of these 8 key pillars that start from having a purpose, to processing your emotions, to problem solving, to having pride, which is an intrinsic sense of self-worth based on self-compassion, proficiency, which is self-efficacy, being present, taking back your time and your focus rather than it being out there in the digital world with comparisons or focused on the past or projecting into the future. People really becoming emotionally attuned to the emotional content of what people are giving you. So going beyond just the everyday chit chat, developing meaningful connections, and then practicing healthy habits. And so I learned that this is the basis. I mean, it took so much research to find what it is and then to put it in a way, at a structure that you can neatly sort of package, if you will. Here are 8 things that you can do, and I start with purpose because purpose is about being intentional about being deliberate. And we know that optimists have exceptional longevity. So what I was fascinated by is, yes, while our lifespan and the number of years that we're living on this earth in the United States is longer, our health span has stayed the same. Our health span, life spent in good health, is stagnant. And what we can do, these optimists have exceptional longevity. They're living well into their 80s. My dad is one of them. They have from dental health to mental health. They take care of themselves. They invest. They believe that good things are possible. They reach out to friends. They offer help to other people. And they maintain a purpose. And one of the easiest ways to have purpose, if you feel like, I don't really know what it is, put the cart before the horse. I would say if you can't find purpose, it's your job to create it. And something as simple as a 20-minute workout can actually boost your sense of purpose. They've done studies on this. They're like, you're feeling lost, go work out. You come back, you're like, I'm ready to go. The endocannabinoids, the endorphins, BDNF, the enhancement in mood, memory, concentration, everything goes up. And you're like, I'm ready. Where is that stack of bills and envelopes? Let's go.
Yeah.
Max, people don't realize it. When you're in a good mood, that one thing that you're going to do, let's say you're going to ask the boss for the promotion, let's say you're going to send that email, you're going to send that DM about a job, you're more likely to do it, So populate your calendar with things that boost your mood and track your mood on a 1 to 10 and say, when is my mood going to be highest this week? And when can I do the most difficult, scary thing right after it?
I love that. Yeah. I mean, I'm in a positive mood, I would say, most of the time, but I occasionally find myself with dour mood. I'm a human being, but I've intuitively, I realized at a certain point fairly recently that it's not in my best interests to respond to people. Like I feel like we have this culture, which you've kind of alluded to, where everybody expects a response from us instantaneously because everybody at this point knows that we all have these devices in our phones and we're all extremely online these days, too online, and so people expect a response from you immediately. But when I find myself occasionally in a dour mood, I actually don't respond to people right away on purpose, because I know that it's not going to be, I'm not responding from a place of authentic, who I am really authentically. I'm not in the best mood. Whatever it is that I say, it's going to be overthought. There's going to be, I always like to save my response, even if it's to family members, loved ones, work emails certainly, but I like to now kick the can down the road to when I know inevitably my authentically dapper mood is going to be, that I'm going to get back to that, because I just know that I'm going to be presenting the best version of myself and not such a great version of myself if I respond when I'm not in a great mood.
Yes. You know, it's so interesting, Max, because somebody asked me this question. It was funny. Like I was like giving advice on a show and I was saying, you know, to stay connected to people. And then this question was like, what if I don't want to, you know? And I was like, you know, it's so powerful, but I would say like the relationships that are really meaningful to you. I think sometimes that's where the communication is so key, that socializing the people in your life to let them know that like, I may not respond to you right away and please don't take it personally.
Yeah.
You know, because a lot of times if somebody doesn't know you or know what you're sharing, they might be like, oh, like, did I do something wrong? You know, like they may internalize it or personalize it, but knowing that about you changes a person's point of view because they're like, oh, he wants to present the best version of himself and he's going to take his time. Then it looks like, oh my God, he's so thoughtful. He values the relationship. You know, it's a reframe.
Yeah.
He values the relationship. Therefore, he's going to put in the time to be a thoughtful response. So that's why I feel like communication is so helpful to be like, when you, like, sometimes people will say to me, I haven't responded to an email in like, I don't know, a year, or like, I never wrote that thank you note after my wedding, or I never sent that baby shower gift or whatever, you know, like that, like we have it in our mind that there's an expiration date on relationships and friendships. And if that time passes, then the connection is lost or, you know, and what I found in one of the research that I was doing is that, and this study came out a few years ago and it was so powerful. It says that people love getting messages out of the blue from people that they have connections with, even if they haven't heard from that person in a long time. And so maybe you get a million DMs and you're just like, no, thank you. I'm not interested in getting random messages out of the blue. But let's say it's a friend, somebody you connected with a long time ago. That person may not reach out to you because they're like, maybe Max has forgotten about me or they're not going to. But, you know, it's an encouragement because sometimes Max is busy. He's doing a million things. The studies show like both parties benefit and that other person is actually more happy to hear from you than you think.
Wow. So powerful. Yeah. I mean, I started dating somebody a couple of months ago and I remember, you know, early on when it was like really important to me to present the most authentic, best version of myself, because I'm generally not an anxious person, but I occasionally feel, you know, whether it's work related or whatever, like I'll feel anxious occasionally. I would, you know, if I would get a text, obviously, I was waiting for text, you know, I was like loving hearing from the person that I had just started dating. But like occasionally I would like actually force myself to withhold the reply until the anxiety passed, because I knew subconsciously maybe, but that whatever it was that I was going to say during that moment of anxiety wasn't going to be, that there would just be something about it that wouldn't be reflective of like who I really am, that the anxiety was somehow going to come through on the screen. And it kind of worked out in my favor, I feel like, because, I mean, confidence is like a weird thing, you know, and it's, I guess like, you know, it's, something there might be like something that feels really kind of like weird to say in a certain moment because you don't have that confidence, you're not in a great mood. But if you just like wait 20 minutes almost, like then it, you know, you feel way more comfortable. It's just like it's a matter of time for the same content, but it's like you're waiting for your mind to get back to that place of, you know, of clarity and peace. Yes,
100%. And like, there's something really beautiful in how our brain subconsciously is solving problems all the time. And I talk about this in the pillar of problem solving, is that at any given moment, I mean, you're talking about a positive interaction with someone you're dating. So it's like, you're happy to hear from them. And like, this is very low stakes, I hope, right? Like, and there's no real problem to be solved. But we could think of problems as like anything that needs to be checked the box on, right?
Yeah.
Like someone wrote to you, you need to respond. So it is a little bit of a task, right? Maybe not problem in the negative sense, but it's something to be done. We're always contending with the battle on two fronts, right? Like one is in our mind, the emotional context, and then one is what are we going to do on the outside? How are we going to execute? So it's important to recognize that sometimes rest and distance and time somehow are able to sort of consolidate for you in a way that you can't access right then and there in the moment.
So true.
The only thing I would say to you, Max, is that being on the flip side of it, because I work with a lot of women who are like, I'm dating somebody and they don't respond to me, you know, and I'm ghosted, or, you know, what do I expect?
Yeah.
So, you know, in a sort of when a person has found the cadence, because there's always a little bit of that, right? Finding the footing. I feel like the communication, because I work with men and women, I work with couples, and I can see both sides of it. I was just talking to a very good friend of mine, and he's super accomplished. You know, he's a little bit advanced age-wise, and he jokes. He's like, I'm no spring chicken, and he's like early 60s, never got married, you know, and very successful, and I've gone to events with him. He's in the media industry, and he'll always be introducing me to like so many amazing people, women who will come up to him and be super friendly, and they'll be CEOs and heads of companies, and I'll be like, dude, what about that? What about that? And because he's always talking about how he wants to meet the right person, and he'll always just be like, no, they're just interested in me for my work, and dismiss and minimize. And then met this like person abroad, and we joked how it was so convenient that, you know, they lived in different time zones, and you know, it didn't work the first time around, and the second time around they're working at it. And one of the reasons was this mismatch in communication. You know, his partner expected a lot more real time responses, you know, and he was like, I felt smothered by it, and I felt like overwhelmed. And now he's like, it's different. He's like, Sue, it's different. Like, I'm responsive to her. I understand her needs. I know she's not trying to control me, which is what I perceived it as before. And, you know, he's like, I thought she was jealous. And I just realized all she wanted was a response in real time. So I feel like that's where the communication can be super helpful, is that two people are looking at the same non-response and reading and inferring meaning into it, when really it's just somebody trying to process. Yeah,
it's so true. There's this new phenomena now that I've heard coined passport bros. Have you heard of this?
No,
this
interesting. What is it?
Yeah, a lot of guys are like going abroad to meet their quote unquote soulmates, because they find dating to be apparent. I mean, dating is I think dating is difficult. This, you know, in this century. Certainly over the past couple of years, social media has made it really hard, but I feel like it can be uniquely challenging in the United States today. You know, so that's what this whole the premise underlying this like passport bro phenomena basically stipulates, that dating's difficult. It's leading a lot of men to seek mates, you know, outside of the country, and particularly in parts of the world where conservative values are more cherished still. You know, it's very interesting.
Traditional norms, if you will.
Traditional norms, yeah, which I think is just a funny sign of the times. You also see this movement online that's referred to sometimes as the trad movement, which stands for traditional. You know.
Yes. Look, you know, it's like different people, different things will appeal to them. I think it's so tricky. What I'm seeing is, you know, a lot of women, and look, you have listeners from all backgrounds, right? And so, and all points of view. So this is not any way to throw shade on anybody, right?
No, of course not.
But what you're seeing is a group of women who are just super productive, advancing in terms of education, because we're seeing enrollment in colleges, more women than men, like in advanced degrees. And I think it's tough. You know, I mean, I can't speak from the male point of view, but I feel like a lot of women are like, where is my equal? You know, and I want to have an equal partner, or even be able to look up to somebody. And I don't know. I mean, there's a variety of reasons. I think there's something called the shallowing hypothesis.
What's that?
Where everything is getting dumbed down from our relationships. Things are so much more superficial. We're swiping. We're like, okay, I'm done with this date. 45 minutes, coffee date later. Who's the next? You know, like we're done. We're just bouncing around. We don't have the attention span to go deeper, whether it's with other people, with our friends, with dates, or even reading material. We tend to, anything that's online, it could be literally, if you took an article and you printed it out, you're more likely to read and absorb that article in a more deeper, engage with it in a more deeper way than you would with that same article online. Because online, you are trained to look at it as like short form content. And so when they do studies and they look at people who read, they'll give them reading comprehension, and they will totally like fail from the online version of the same reading content. So that's where books come in, like hard, you know, holding it in your hands and reading. So, I mean, there's a variety of, society is shifting so much, what we want, what we expect, what we have tolerance for, you know, and that's another thing that makes me sad, is that like, we're so quick to have things at our fingertips that we don't deal with frustration tolerance. Like if you ask me like what I would want to instill in really young kids, it would be delayed gratification, frustration tolerance, the ability to persevere in the midst of failure, self-efficacy, right? Cultivating joy. So these are all things that are within your, you know, control.
Yeah, totally. I call it just another form of ultra processing.
Interesting.
Yeah, you know, I mean, I wasn't aware of that hypothesis, the terminology per se, but it's to me, you know, the same way that our food environment is now 73% ultra processed and increasing by the day. it seems like our information has become ultra processed.
Yes.
Our content in many ways has
Yes.
become ultra processed. Our sources of entertainment have become ultra processed, and it's just really problematic.
I'm going to add to that two things also I'm seeing is the homogenization of thought, of appearance. So like as social media starts to reach in more and more remote parts of the world, the concept of beauty, like there was an article written years ago, I want to say it was New Yorker, if I'm not mistaken, but don't hold me to it. It was called the Instagram face, and it was how we all everyone wants to look the same. They're all going for the same look, the same eyes, the same lips and nose and whatever, and cheeks, and younger people are getting, initially all this aesthetic stuff was, youth or whatever. It was more anti-aging. Now it's enhancement, and younger people are getting it, but everyone kind of looks very similar. So that, and then also I want to say sort of like desensitization and sort of like numbing to pain, to other people's grief, to kind of look at violent images and just be like, yep, this is normal. It happens all the day, and a dehumanization of people.
Yeah, totally. The homogenization of all things. It's so true.
And how everything has to be sensational. Like if it's going to capture your attention, it has to, like a video has to capture attention in 3 seconds. And so we all, even if you're giving out great content and it's informative and educational, it also has to be entertaining. And if you lose that, like the other day was so funny, like I was talking to my book agent and we were talking about television, and he was just like, yeah, like there's some show on HBO and everybody's naked and like that's what you have to do. And I was like, no, I'm keeping my clothes on. I'm sorry. And I'm not dating, so it's not working for me. Like we were talking about, adapting, how do you adapt a book into something, documentary or whatever. And it's like, that's what things have to be. They have to be ludicrous, ridiculous, over the edge. Oh
yeah. You see this with wellness influencers now. The more ridiculous, the more restrictive a person's take on food, for example, the more they seem to, the bigger the platform they seem to grow.
Yes.
Yeah.
Like you have to be, it's interesting, controversial for sure. And like, I get it that there's this delicate balance between the best way to educate people is also to inform and entertain, like 100%, right? But just the fact that our, like the IQs have dropped, in the last several generations. And so we're like the ultra processed for sure. And also because of definitely things in the environment, but also we just don't have attention spans.
We don't have attention spans. Yeah, it's so far. And on the other hand, like long form podcasts seem to be at peak popularity.
So fascinating.
Which is probably a response actually to people wanting real information, real nuance, to be able to listen to real nuanced conversations amidst this sort of environment where everything is just getting shorter and shorter and shorter form. And it's like the TikTok culture,
Yes. And what's interesting, Max, I don't know if you've ever thought about it or what you think about this, but loneliness and feeling like disconnected. And I feel like podcasts fill a gap, like whether or not you realize it, but you feel like you just spent time with two friends, or a friend and their friend, and you're a fly on the wall and you got to hang out with some interesting people for the day. So I don't know what you think about that. Do you think that it fills it like a social void?
Yeah, I think it's actually really cool and interesting. People will often, like listeners of the show will often approach me in the street now, and they approach me as if like they know me, like they approach me as if they're my friends, which is great.
I love that.
Because we all are friends here on The Genius Life. But sometimes I get confused and I think that I think that they're actual friends who I just like forgot who they are, because I meet a lot of people on a day-to-day basis. And my producer Sydney is with me sometimes when this happens, and she's like, she watches me. It's like so embarrassing. She watches me, it's my instinctual response is, oh, it's so good to see you, with the way that they respond to me. And then like 5 minutes into the conversation, they're like, we don't actually know each other, right? I'm just like a fan of your show. Yeah.
But they feel like they know you.
Well, of course they do.
Because you share your journey with people. Yeah.
I mean, 3 hours a week, they're listening to me, and I share funny, embarrassing stories about myself. They've tracked my journey with whether it's with my, the situation with my mom, my career, my relationships, like. It's wonderful. I love it. But it's what do they call it? It's parasocial relationships.
Parasocial
relationships.
Absolutely. And I had written about that, and so many things. I mean, I had written that had to get cut out because this book is already 300 something pages, and I wrote 3,000, which is kind of embarrassing to admit. But like, you know, each chapter was like a book in and of itself. But the parasocial relationships, it's so fascinating because it's one-sided, yet it gives us so much meaning. You know, like your fans feel like they know you, you know, and that they get to have a part of you. But and because of DMs, we also live in that illusion that we are one message away, right, from our favorite influencer, celebrity. So, and they might be, right? Because maybe you've met people this way, you know?
Yeah. All the time. And I love it. I wouldn't have it any other way. I mean, it's fantastic.
Do you ever feel tired by it? Because there's a price to pay, right? Of being so out, you know, like out in the world.
Yeah. To be honest, it's mostly good. I mean, there's only been like a very small handful of instances where it's gotten weird or inappropriate or scary, but very, very small handful. I mean, I could just, you know, like a couple months ago, I was leaving a supermarket. It was like 11 o'clock at night, and I was just like stocking up on stuff I needed for the morning, and it was like this dark parking lot, kind of close to where I live, and like I was in my pajamas or something, or like, you know, close, and I'm like walking back to my car with the groceries, and like somebody in the parking lot was like walking really, like I could see them in my periphery walking like really kind of close to me, and I was like getting a little freaked out, and then they said something like, "Oh, you're the health guy, right?" And I jumped, like it like freaked me out a little bit. Oh my God! I didn't get mad, you know. I was like, yeah, because to me it's like it's such a privilege.
Yeah, that's sweet. That's awesome.
But you know, I guess like people should have like a little bit more like
personal space,
emotional intelligence, you know, especially if it's 11 o'clock at night in a dark parking lot in West Hollywood.
Yes. Do you get judged at your grocery cart checkout?
I mean, people at the supermarket all the time, which is great. And typically, I mean, I practice what I preach.
Yeah,
so.
I know, because I remember having lunch with you one time, and it was like a vegetarian or vegan Indian restaurant in the city. And I was like, okay, Max, what are you eating or not eating? You're like, no, I'm good, I'm flexible. But then you also were like, you know, I want to be careful to avoid or limit whatever, you know, sugar or whatever. I don't remember what it was exactly.
I remember the restaurant. It was not a vegan restaurant.
Okay.
It was Inde. Wasn't it?
Yes,
Down
good
in,
memory.
Yeah,
yes.
I remember that.
Yes.
Yeah, I eat my Genius Foods.
Yes.
But no, definitely it wasn't a vegan restaurant.
But vegetarian, right? Was it?
It was.
Maybe.
It was like the whole restaurant was gluten-free and dairy-free, if I recall correctly. But no, they had meat.
Okay.
They had meat, yeah. Yeah, your boy needs his protein.
Yeah. But it was low sugar. There was something, you had some specification. Was that
It
right?
was, yeah, probably, well, maybe at the time I was like really low on a low-carb version of my diet. I don't know. But no, I've always been pretty protein focused, and definitely I've never been vegan or vegetarian. Thank God.
Never. Wow.
Yeah,
okay.
never.
Cool.
Yeah. Fairly consistent. So for people listening to this, what are 3 things that people should start doing today to support their mental health?
Yes, I'm going to give you 4.
Give me 4.
I'm going to give you 4.
Yeah.
So they're the 4 M's of mental health. Right. So starting with meaningful engagement, and this is my favorite one of all of my 4 M's, because it means being intentional and with your relationships, and social snacking. So people always think I don't have time to invest in friendships, or who has time? It's a luxury. And I would say literally it could mean you going to a exercise class, fitness class, cycling club, whatever it is, 10 minutes early, making eye contact with people. It could be the dog walker, the barista, your Uber driver. I am notorious for having very long conversations and becoming best friends, like, you know, friendly,
with your Uber drivers?
Friendly.
What's your rating on Uber? Do you know?
Yeah, I don't know.
There's a way to find that out. Yeah. I wonder if it's like really low, or it's either going to be really low or really high.
Yeah. It's funny. Like, you know, obviously the occupational hazard of being a psychiatrist is people tell you their life story, but I also enjoy it, and I invite it on some level because I'm just naturally curious. I'm going to end up in conversations asking people questions, or they feel comfortable sharing with me. And I grow so much by these conversations. So some of it may be with people that I'll never see in my life again. So just utilizing opportunities for connection. And that's another thing that studies show, that people, strangers, benefit from each other's conversations more than they think. So they did a study in 2014, and I believe it was in Chicago, but like looking at people in the subway, you would think they'd be weirded out, but instead they found both sides gave each other higher ratings than expected. And there's this thing called the liking gap, where we always think people don't like us, but we find that people actually value us more than we know. Another thing that happens is people don't ask each other for help. And the person that you're asking, you think you're imposing on them, and the vast majority of the time, that person, studies show, is more than happy to help in whatever way they can.
And it's actually like relationship building.
Yes, exactly.
Wow.
And some of the closest friends I've made was like in moment of need, like of either one of our needs. Like I think it's so hard to go deep and go vulnerable, and it takes a lot for someone to have to ask for help from a friend, to be like, things that we used to take for granted, we're losing. Like before, back in the day, you might have had to ask a friend for a ride from the airport or to accompany you somewhere or drive you, and we don't have that. There's an app for everything. You're not calling anyone to fix your toilet or a flood. So we're losing these built-in moments of connection. So anything that you can do to prioritize in your calendar, look, when am I going to see someone face to face this week? Text messaging is great, FaceTime is great for the in-betweens, but that is what exactly it sounds like, is social snacking.
Social snack, I love that.
Yeah, and they're like micro connections. So they serve a purpose, but just remember, like, snacks aren't the main meal, and that's why it's really important to, if you can, once a week, schedule a face-to-face and go deep. Talk about your vulnerabilities, your pain, your losses, your grief, your blind spots, what you're struggling with, what you want help in, right? It's not going to replace therapy. So that is something that I recommend, talk therapy, if you can do it. But the meaningful engagement is both the superficial level social snacking, but also going deep and sharing vulnerabilities. So scheduling that in, like, your life depends on these 4 M's. These are science backed. You have to do this. The next one is mastery. You don't have to be a master to experience mastery. I was interviewed recently in the beginning of the month by the New York Times. It was called a 6-day energy challenge. And the writer Jancy Dunn had interviewed me, and we came up with this concept of low stakes flow state, which is do 10 or 15 minutes of something you don't have to be good at. For me, it's like salsa dancing. I may not be great, but I feel a sense of mastery of like, oh, I am learning, I'm getting better at something. It could be playing chess or gardening, musical instrument, a sports, a language, using a language app. So that's mastery. And each of these, just spend 10 or 15 minutes. Mindfulness, all it means, some people are like, I don't do meditation. Some people love meditation. Some people feel like, I'm afraid I'm going to be with my thoughts and I'm going to ruminate and I don't love it. Fine. Just do anything you do single-mindedly. That's it. If you're going to wash dishes, you can listen to the Genius Life podcast, but that's about it, right? But try to do something one at a time. The multitasking is what's taking away from our mindfulness. And then lastly, I would say the movement, just the way you have social snacking, right? You have exercise snacking. These built in, a lot of times people aren't incorporating the movement because they think of it as a mountain. Then I don't have 90 minutes. I don't have the boot camp 60 minutes. Fine, 10 or 15 minutes parking lot. Like, that's one thing I love about being in an urban environments, is that walking is very much encouraged and facilitated as much as possible. So the stairs in your building, people who work out at home are more likely to work out. So having access to the weights, the mat, whatever you can manage. But the key with the 4 M's is that you have to be intentional. You have to be deliberate. You have to plan out your week. And Max, I had to come up with the 4 M's in the midst of a very interesting experience. So it was April 2020, and I get a call from Global Citizen, and they're putting on this benefit they have the likes of Elton John and the Rolling Stones and all these fabulous people, and they're telling me about it. And I'm like, great, I'll be watching from home. And they're like, no, we want you to be on the show. And I was like, oh, I don't sing and I don't dance. You definitely don't want to see me doing either. So I don't know what you want. And they're like, no, we want you to share a message of hope and positivity and how people can give us habits and give us like ideas of how to help people. And I was like, great, like, do I have an hour? And they're like, no, you have 59 seconds. And I was like, 59 seconds? What am I going to give someone that can change their life in 59 seconds? And so I was like, okay, what is the best science? What are the best habits? What are the best tools that someone can use no matter where they are, and they're free and they're accessible and it will positively, guaranteed, have impact on your mental health today? And those are the 4 M's of mental health. And anyone can do them. Doesn't matter what your level of ability is. Access.
I love it.
Thank you.
I love it. So good. Well, people should definitely pick up Practical Optimism. And you're such a light. Thanks for doing what it is that you do. I mean, I know that you have, you're building you already have a huge platform. You do all these TV shows. You're definitely one of the goats in the space. But I'm super excited for people to get this in their hands finally and have like a piece of you to own.
Thank you so much. That's so nice. And I so admire your work. So I'm just so glad that this worked out and we could have this conversation.
Thank you. You're the best. Well, I've got one last question for you before we get to that. Where can people connect with you on social media, and where can they pick up your book?
Yes. So you can buy Practical Optimism wherever books are sold. And please connect with me on social media, on Instagram, Dr. Sue Varma, the word doctor spelled out.
Spelled out. Nice. Yeah. What does living a genius life mean to you? It's a bit more philosophical, but
Yes.
Yeah.
I love, Max, I love this title, Genius Life, because it really is about cultivating curiosity and being a lifelong learner. And I know you are. And, I think that always challenging ourselves and being playful, and finding fun, hope, fun, and curiosity. Those are like the three sort of big values, I would say, that mean a lot. And that's what the Genius Life means to me, because you share positivity and pragmatism, which is what Practical Optimism is about.
Yeah, and we're always getting better. We have a growth mindset. We're always learning. Definitely like I'm a lifelong learner, and I compel my audience to adopt the same mindset.
And you know what's interesting, Max, is I said to you with the mastery that you don't have to be a master to experience mastery. Like when you think of Genius Life, right, people are like, oh, but my IQ, I'm not a genius. And like the key of the genius, right, is something deeper, I think, right? Like to me, a genius is someone who's willing to be aware, to self-reflect, and to grow.
Yeah. Yeah, totally. I mean, I'm not right about everything. I haven't been right about everything, but I'm always willing to, to update my my perspectives and to share with my audience vulnerably, like where, maybe I've been not necessarily wrong, but where I'm never afraid to like update my audience on where my views have changed.
Yes, I appreciate that.
Yeah.
And and that's like key in terms of emotional processing, is constantly updating our software, right? Because
Always.
we have these outdated scripts that sometimes limit us, that handicap us, that make us think that we can't do something. So constantly updating information, knowledge, curiosity, all of that.
Yeah, I love that. Our iPhones are constantly updating. Our computers are constantly updating. Our technology is constantly updating. Yeah, why shouldn't you?
Absolutely. Right? I love that. Great line.
Yeah, I love it. Well, you're the best. Hey, if you liked that video, you need to check out this one here, and I'll see you there.